Dick Torrey has dropped by from Torrey Enterprises. Thanks so much for coming by, Dick.
Thank you for having me.
All right. Well, you know, it's obvious from anyone watching this that you've brought some friends.
I have. They travel with me often.
Before we introduce them, I'm going to ask you to tell me about Torrey Enterprises.
Well, it's a company that I started back in 2014. Torrey Enterprises actually has a little bit of a background. My dad used to work for IBM, and when he retired, he started Torrey Enterprises fixing copiers and typewriters, and he passed away back in 1987. And so it kind of lay dormant for a minute. I was trying to come up with a name for the business, and I kind of thought that was kind of apropos to have that and kind of continue on that legacy.
That's really nice. That's really. So you resuscitated it, could we say?
I did. You could say that. Yes, you could say that. Yes, the good one. Yes, yes.
So tell me exactly what you teach.
Well, we offer a bunch of different classes. We offer CPR training. We offer first aid training. There's so many different businesses and walks of life that actually need this training. Anywhere from a tattoo parlor to lifeguards to nursing homes to, I do a lot of training with new parents.
So these are all people either professionally or personally.
Correct.
They want to know what to do in the event of an emergency where someone might need CPR.
Correct.
Or I know many moons ago I was a lifeguard, and we have to know what to do in a lot of different scenarios. So
that's right, and a lot of changes since way back when we did it. I did it through Boy Scouts and things when I was a kid. But I think there's been a lot of changes since then. But it makes it easier for the general public to actually know it.
So tell me about some of the changes. What might people be surprised to hear?
One of the biggest changes over the years was the taking out of the mouth-to-mouth resuscitation. A lot of people would be really leery to actually do that if they don't want to catch a disease or they don't want to have anything else go wrong. So a lot of times people won't do something because of that reason. Now they've come up with compression only or hands only CPR, where all somebody has to do is just the chest compressions, just hard and fast, and that's going to be the best thing for that person.
So you do first aid training of all stripes? I mean,
yeah, we do anything. I've taught basic EMT programs before.
That's a lot more than just first aid.
It is. It sure is. It is much more involved.
Yeah.
We've done that before. We were also doing most of the thing is the first aid training. I do a lot of EMS education as well for different fire departments and ambulance companies and people that just need to recertify every 2 years. They need a certain amount of education, so we offer that education as well.
So it must be highly regulated then.
It is. It has to. It's regulated by the National Registry of EMTs, and we have to do so many hours of one type of training, so many hours of two other types of training, and then every 2 years we have to do that to recertify.
Oh, okay. Tell me more about this guy.
Well,
on Plymouth Rock.
On Plymouth Rock.
Like he washed up.
He did. It looks like he did. Wouldn't be the first time. So we have mannequins. We have different mannequins. They've come a long way since back when I first started with the technology of the mannequins. These mannequins actually have instant feedback, so it shows you if you're pressing down deep enough, if you're pressing fast enough.
Wow.
It gives you instant feedback. And there are also some recording mannequins that are out there. I have one of those. It actually it will show up on a screen, your depth of compressions, your speed, to make sure you're kind of doing it right. So they have adults, they have babies, they have children.
Yeah, let me just.
Sure.
I'm going to be very careful because it is a baby. There we go.
Yeah, and it's pretty lifelike to a real size infant.
Yeah.
And it also helps people get kind of used to holding an infant in case something happens as well.
So I'd learn the compression, like how to.
Yes.
The placement.
Yeah, hand placement and speed. And
this looks like there's maybe some noises it makes. Looks
yeah,
like
actually, well, this button right here, it actually turns on, and what that does, that
that's
gives
a
you
little
this.
creepy.
It is a little bit. It actually gives you lights to see if you're doing it correctly or you're going too slow or too fast.
Okay.
And one of the other mannequins I didn't bring today was actually a dog. We offer pet CPR and first aid as well. that's kind of a new little venture that we're kind of spreading out. Was, as they said, there's about 65 million dog owners in the country, and a lot of people actually treat them like their own children.
Right.
You know, I've gone to calls as a paramedic before for a baby not breathing, and we show up and it's actually someone's dog.
No.
Yeah, because they actually call it their baby, and a lot of people do. And so there's a lot of call for. I started getting calls for, do you offer pets CPR or pet first aid, and that was something that we kind of started not too long ago.
Okay, consider my mind blown. That's a new one.
Mm-hmm.
That's so
dogs
interesting.
choke, dogs get cut,
Yeah.
dogs drown. Dogs do a lot of things people do.
Yeah,
And
That's
the first aid and
fascinating.
CPR is pretty much the same.
Wow. I tell you, I have a rescue Chihuahua. You would not want to be near that breath. So I'm glad there's this is all
No hands only.
Yeah. So now this is a defibrillator?
Yeah, that's an automated external defibrillator, or AED, through a lot of different programs.
I did not mean to do that. Okay, how did
I just pressed the button again.
I broke it?
So what this does is actually restores a normal cardiac rhythm. These used to be very, very hard to find. They're all over the place now. A lot of public buildings have them, schools have them. You can actually buy one for your house if you wanted to. They've been deregulated, so you don't need a doctor's prescription for them anymore. You can just have one at your house. Especially if you have somebody that's a cardiac patient, or has had cardiac surgery, or had a heart attack before. This is the thing that saves lives. It's good CPR and getting this AED on somebody as quickly as possible.
Okay, so I know they're required at health clubs and a lot of public places. So someone suffering someone is in distress from, how do you know it was their heart?
Well, it's very simple to kind of check for responsiveness.
Okay.
You can shake them on the shoulder and ask them if they're okay. Then the biggest thing is to call 911 and have 911 responding to you. You don't want to do this by yourself. All we're doing is checking for breathing, checking for rise and fall of the chest, and if not, then it's assumed that something going on with their heart, and just start the compressions. Then as soon as this shows up, stop your compressions if you're doing this by yourself, turn the machine on, follow the prompts. It's very, very easy.
Wow, okay. That's amazing. It's so automated compared to when I took this
It
many years ago.
It is. They've had AEDs around for about 25 years, and this is one of the easier ones to use.
That's amazing. Well, we've run out of time. I can't believe it. We're going to have you back to explain more. This is fascinating. Thank you so much.
Very good. Thanks for having me.